When a mom can't be with her children because she's in the hospital with abdominal pain that wasn't treated on time, that saddens me. My name is Dr. Lou and I'm an infectious disease doctor. Everyone has had or will have abdominal pain sometime in their lives.
Okay, what poison mimics the symptoms of appendicitis?
Bad outcomes can be avoided. This is why you need to learn what to look for and prepare for what to do now. In this video, I'm going to share 5 abdominal symptoms to never ignore.
Well, I got this blinding pain in my stomach when I was lifting weights before.
Number 1, if you have sudden abdominal pain that doesn't go away within 30 minutes, you need to see a doctor. Your gut is one cell layer thin and it can die quickly, causing an explosion of poop into the abdominal cavity that can kill you. Your life is worth the inconvenience of a trip to the emergency room. Pain is experienced differently by so many different people. It's like childbirth. Some women, they curse on the top of their lungs, and other people, they just whimper. Nevertheless, if you have the worst pain in your life that doesn't go away, please see a doctor ASAP. That means the inflammation is getting worse and tissue may be dying. Let me tell you a story. Let's call her Sarah. She was a healthy mom of 3, juggling her online business and homeschooling. Out of the blue, one morning, Sarah woke up with mild abdominal pain. That was then followed by nausea, exhaustion, and worsening abdominal pain. She refused to call her doctor or go to the emergency room because she didn't want to leave her kids. Her husband was working and she didn't want to disturb him. After 24 hours, she finally went to the emergency room and had a diagnosis of a ruptured appendix. That means her inflamed appendix blew up and popped poop all over her insides in her belly. So when I saw her, she had a drain in her abdomen. She had no appetite. She was soaked in sweat and all she wanted to do was sleep. Had she come in earlier, maybe she wouldn't have ruptured her appendix. Number 2, if you're having vomiting or diarrhea, you can get quickly and severely dehydrated, lose critical minerals like potassium and magnesium. And this is especially true for older people with medical problems. Sarah, even though she was only 34 and healthy, she got dehydrated really quickly because she was vomiting, and that clouded her judgment and prevented her from healing, really. When you are dehydrated, your body gets into stress mode, reduces your blood flow to your gut. But that's the opposite of what Sarah needed to heal. She needed to be hydrated to improve her blood flow to get her immune system to heal her appendix. So if she had come to the emergency room earlier, she could have gotten some IV fluids and maybe she could have avoided the perforation. And this is why you need to know your blood pressure and act on that information. Appendicitis is usually considered to be a medical emergency.
You need an operation. You have appendicitis.
Sarah waited too long, but really it wasn't her first time she had this episode. She's actually had the same abdominal pain twice a year for 3 years prior to this last time. And she always waited for 24 hours and it would stop and the pain would go away. But this time it didn't. So she really had chronic appendicitis, which is very hard for the doctors to figure out. Her intestines were inflamed. She had a total of 6 episodes over 3 years. Isn't that curious? Her body was rejecting her food, but she never put 2 and 2 together, and she never asked for help. She never saw a doctor. Many people think that when you get your appendix removed, you have nothing to worry about, but that's false. In fact, appendicitis is associated with getting diverticulitis, which is inflammation in the pockets of the colon that people get from not eating enough fibrous plants. So whether it's appendicitis, diverticulitis, ileitis, colitis, irritable bowel syndrome, or constipation, inflammation is inflammation. The question is, what is the root cause of the trigger? Because if you don't figure out the trigger, you're going to continue to suffer. Number 3, if you have a fever, if you have a temperature above 100 degrees Fahrenheit,
All right, you're burning up.
You're burning up.
Call your doctor. Fever is one symptom of inflammation, just like pain. Fever may be a sign that you have bacteria in your blood called sepsis. If you are shivering with your fevers, you most likely are septic and you need to go to the emergency room ASAP and get some blood cultures, fluid, and antibiotics. I'm sure you've heard food poisoning causes gut inflammation. Did you know those same germs can travel to your liver, your heart, your kidney, your brain, your bone to cause infections? Common ways to get food poisoning are improperly canned foods, pickled foods, uncooked or undercooked foods like eggs, chicken, meat, or seafood. So don't eat raw liver. Really, any food that's contaminated with bad germs can make you sick. Even unwashed vegetables like spinach and alfalfa sprouts. In fact, you can't wash alfalfa sprouts well, so please don't eat them raw. Number 4. If you have an elevated heart rate above 100, a low blood pressure below 100/60, you may be septic. This is why you need to have a blood pressure machine so you can check your own vital signs at home. Sepsis needs aggressive treatment right away. 27% of people who are in the hospital and septic will die. But hydration and antibiotics started within an hour can improve outcome. You don't have to eat bad food to get bad germs. Germs on your pets that are on your birds and reptiles and other animals should not be in your gut. Turns out Sarah had a pet turtle that lived in her kitchen. Turtles and other reptiles and birds all carry bacteria like Salmonella, which classically give people food-borne illnesses. So don't hug your chicken or turtle and wash your hands. However, you don't need a pet to get Salmonella poisoning. If you bring home meat, chicken, eggs, Salmonella and other bad germs are on those foods. So don't wash your raw animal products in your kitchen sink or you can contaminate your whole kitchen and get food poisoning. Water, unfortunately, is a great source of germs, especially because animals pee in water. So if you're playing in water, be careful of lakes, rivers, oceans, pools, and jacuzzis. Be careful not to swallow the water. Number 5. If you're pooping black tarry stools or have bright red blood in your stools, go to the emergency room. This could mean you are bleeding inside. This is why you need to look at your poop every day. Take a picture of your poop on your cell phone to show your doctors if it's abnormal. Bleeding is a sign of damaged tissue and possibly dead tissue and is commonly seen in people who take non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, naproxen, and celecoxib. Many of these pills, which are over the counter, damage your gut and kidneys. Don't take them regularly. They are not safe, especially if you have a history of ulcers. They may have caused your ulcers. Anything that destroys blood flow can kill tissue. High salt, high fat, excessive sugar, or toxins like heavy metals can slowly or quickly destroy tissue depending on how much you're getting in your food. If Sarah corrected her diet after her first episode, maybe she could have avoided further pain and episodes and prevented the ruptured appendix. For women, sometimes bleeding is hard to tell if it's coming from the rectum or vagina. If you have abnormal vaginal bleeding with abdominal pain, you may have an ectopic pregnancy, you may have a bleeding fibroid, or it could be the first sign of cancer. These, of course, are not the only reasons to see a medical doctor. If you think you may have a medical emergency, do not hesitate to seek care. Sarah's story ultimately ended well, and she recovered and went home to be with her kids. I had a long talk with Sarah about improving her diet, and it's been over a decade without any further abdominal problems. Healthcare is a partnership between you and your doctors, but you know your body better than anyone else, and only you can decide when you need that help. So don't be shy to ask for help, talk to your doctors, and remember 5 abdominal symptoms to never ignore. If you like this video, you'll love the next one. See you there.